You are now listening to Nailed It, the Orthopedic Surgery Podcast.
And moving forward, what are some of the female risk factors for having other injuries? They can have, their increased risk for different knee injuries. I know we'll talk about ACLs. They can have, patellar instabilities. Can we kind of just go through some of these injuries that, females are at an increased risk for having, and then actually say what injuries those are?
So, female athletes are at higher risk for, some of the things we've touched on, certainly much higher risk for developing stress fractures, for some of the risk factors we've already touched on. Female athletes much more commonly than male athletes tend to have anterior knee pain or patellofemoral pain. Also a much higher risk of ACL tears in female athletes for a variety of reasons, very specific risk factors, and I'd be happy to talk about that in more detail. Certainly one of the main contributing factors to increased risk of knee injuries around the knee is the fact that female athletes have a higher Q angle about their knee. And there are some great pictures of this on the internet too. And certainly this is something that comes up on the in-training exam, but that tends to put more stress across the knee. And so female athletes get pain with like squatting, kneeling, running, going up and down stairs. That's very common with patellofemoral pain syndrome. And overall that diagnosis is much, much more common in female athletes.
Yeah. And can you describe what the Q angle is? We may have some listeners that are fresh interns or, second years that have not done a day of sports yet. Can you kind of just go over what that is?
So the Q angle is defined as the angle between the quadriceps, like the quadriceps muscle that they come down, and the patellar tendon. And the Q angle in general is higher in female athletes than male athletes. And that absolutely is a contributing factor, especially for ACL tears.
Yeah.
Additionally, female, there are studies too. I think there's a little bit more of mixed literature in terms of risk of patellar instability in female athletes versus male athletes. I think if you just think off the top of your head, being in sports medicine and as you get later in residency and what you've seen like in some articles and on your tests, like certainly it comes up that female athletes are at higher risk for patellar instability, but I feel like there's some mixture in the literature as you read more and more articles.
Right.
But certainly that's an injury that we do see quite commonly in our female athletes, but not nearly as common as ACL tears.
Okay. And patients that do come to your office and kind of complain of this anterior knee pain, is there any treatments that you do? Do you send them to therapy, or do you just, what is your treatment algorithm?
Yeah, that's a good question. It's a hard, it is a hard thing to sort of manage and explain to the athletes that it is common. I think probably the most common age group I feel like that I see this in are like teenagers too. They tend to have that anterior knee pain. And I think in part it's related to the fact that they're growing, right? And the bones grow much faster than the muscles and ligaments, right? The muscles and ligaments can't keep up. And so I think it's an imbalance in strength. And so for those athletes, for, these patients specifically with patellofemoral pain, 100%, I would send them to physical therapy, and they tend to get a lot better. And when they're in physical therapy, I totally defer to the physical therapist to decide what modalities may be helpful, if taping might be helpful. Like certainly that's something that can be incorporated. But I don't dictate that level specifically, but I will absolutely have them go to physical therapy. And way more often than not, they get a lot of pain relief from that.
Yeah, I think physical therapy, does wonders for these patients. Not like I have many of these patients of my own, and I send them to physical therapy, but from what I've heard from different orthopedists, I've heard therapy helps very well. Now,